Chronic pain has a way of reshaping a person's whole life. Every week in my clinic here, I see people who walk in unevenly, tentatively, every step carefully and intentionally. Some can no longer lie flat on my examination couch. So we improvise and we do our skin checks with them sitting and standing. This modification suited me perfectly. Tell you about my encounter with my back later. For many patients, lying down face down is almost impossible, even for a short skin procedure. When pain forces you to make these many adjustments, it is more than just a back problem. It affects the entire person's life. By the time people hear about neuromodulation, many have tried many things and they are understandably tired. They've tried medicines, injections, physiotherapy. Some have even been through one or two spinal operations and still wake up each morning with that same sharp, burning nerve pain running through their body, down their arms and legs. When someone mentions another procedure, especially one with a promising modern name, their first reaction is often a quiet weary. Please, not another, not again. So let's step back a little. Neuromodulation is not a dramatic or mysterious concept. It's simply the idea of using tiny electrical pulses to calm overactive nerves. Those nerves that keep sending signals, pain signals, long after the original injury or inflammation has settled. It is not about switching nerves off or electric shocking the whole body. It's about calming down the signals to the brain so that it is not constantly bombarded with these pain messages. The technology isn't brand new, but the devices today are far better, smaller, smarter, and more adaptive than the earlier versions. Some sit under the skin, near the spine, others use external components. Many now adjust automatically when you change position, but the principle is still the same. Reduce nerve-based pain, the shooting, electric, burning kind, not the pain of arthritis or strained muscles. The distinction matters. Neuromodulation works best for true nerve electrical pain, especially the trembling and tingling kind. For the right person, it can make a real difference. Across long-term studies, around two-thirds, roughly 70% of well-selected patients experience meaningful relief. That might mean walking further, sitting more comfortably, or sleeping more deeply. A life with more control, fewer limitations, and more activity. Pain is personal, and people do their best in different ways. About 10 to 15 years ago, I had my small share of this back pain. My work as a skin cancer doctor involves bending forward for close skin dermatoscopic examinations, often leaning over patients on the couch. One day my back said, "You can't do this anymore. I'm worn out." For months at a time, I struggled with pain. Each episode took at least 3 months to settle, and then it would return again and again for almost 5 years. Fortunately, I could manage it without surgery. I tried numerous therapies. Most helped in some way, none were miraculous. The real mainstay was regular, simple, structured, and specific stretches and exercises, which I still do each morning until now. This is why outcomes vary. Chronic pain is not a single layer problem. The cause matters. Sudden injury, long term minor strain, or underlying disease. Pain starts in biology but quickly spills into mental health, your sleep, mood, confidence, and becomes a condition in its own right. Neuromodulation is only part of the bigger picture. It works best alongside gentle movement, realistic goals, physiotherapy, and a pain team. Pacing strategies, and it should never stand alone. Modifying my own work, doing skin examinations with patients sitting or standing, or adjusting the couch height up and down instead of bending over has made a huge difference to my back and posture. Now back to neuromodulation. Nothing is rushed. There is a short trial period first, using temporary leads connected to an external controller for about a week. You go about your normal life and simply observe. Is this pain less? Can you move more freely? Are the tasks previously too difficult now manageable? Is there at least a 50% improvement? It may be worth continuing. If not, the trial ends. There should be no pressure and no long term commitment. Is age a barrier? No. Many in their 70s do very well, mostly because they understand steady follow up and realistic expectations. What matters more is overall health, skin healing, infection risk, diabetes control, mobility levels, and your goals. Like any procedure, there are risks, and there are battery changes every few years. These are genuine considerations. Technology can help. A steady approach with no hype, but wisdom guides its use. You deserve to know this option exists, not as a miracle, not as a last resort, but as something to discuss with your specialists when other treatments have done what they can and pain is still unacceptable. For many people, neuromodulation gives back a measure of normal life, sitting through a family meal, walking down the driveway, sleeping through the night, or planning a day without pain. In the next episode, we'll explore how doctors decide suitability, what the trial involves, and the key questions you should ask. With health matters, clarity first more than hype. I'm Dr. Chris Ho, and I remain deeply interested in how this technology continues to evolve because I've had the experience of back pain before.